Glaucoma is one of the major causes of global blindness. This irreversible condition is regarded as the silent thief of the sight and affects about 78 million persons. Today on Sound Health, this is our focus. Good evening, I am Olasumbo Modupe. Thanks so much for joining us once again this week. The conversation begins after this break. Please stay tuned.
A clear fluid flows through the anterior segment at the front of the eye, nourishing tissues. At the open angle where the cornea and iris meet, the fluid flows through a spongy meshwork and leaves the eye. But if it passes through too slowly, pressure inside the eye rises to a level that damages the optic nerve, resulting in vision loss due to open-angle glaucoma. Untreated, the vision loss progresses from normal vision and no pain to gradual loss of peripheral or side vision and eventually total vision loss.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Gloria Okoekhian, the chairperson, Nigeria Optometric Association, Lagos State Chapter, and she's going to share her expertise on how to prevent and live with glaucoma. Good evening, Dr. Okoekhian, and thanks for joining us.
Thank you for having me once again.
All right, about 1 in 200 people aged 40 years are living with glaucoma. Most of them don't even know they have this condition. Tell us, what exactly is glaucoma and how does it lead to blindness?
Thank you. You see, glaucoma is a group of eye diseases that gradually steal sight without warning and often without symptoms. That is why, like you rightly put it, a good number of persons suffer from glaucoma without knowing. And it's one of the reasons why globally glaucoma is the leading cause of irreversible blindness, because it doesn't give any sign or symptom at the early stage. This is because the condition is such that the pressure within the eye builds and increases above the normal without the person knowing what is happening within the eye. And as the result, as the fluid builds within the eye, the pressure rises and then invariably causes damage to the optic nerve, which is the part that connects the eye to the brain, through which signals are transmitted for one to be able to see. Now, because it doesn't give any sign or symptom, the damage starts and slowly and gradually, if not detected early, can lead to blindness. However, early detection is key to preserve one's vision and prevent irreversible blindness. That is one of the reasons why globally you can see that there is an increased awareness, increased sensitization of the public on what glaucoma is as a disease and how they too can preserve their vision and protect it by early detection, which is simply put, ensure that you have your eyes examined at least once in a year, because it is only when you get to the doctors that the different eye examination procedures can be carried out to now detect whether one has glaucoma or not.
All right. Does it affect older persons alone, and who are those at risk of glaucoma?
Well, as a matter of fact, age is one of the key risk factors to developing glaucoma. Age, like from age 55 and above, is a risk factor to developing glaucoma. However, because family history is also another risk factor, it now makes it, it cuts across every age, because if there is a history of glaucoma within the family, invariably, children who are 18, 16, we've had cases of, you see children at the age of 18, 16, or even younger. So even at 40, 30, whatever age it is, what is important is, aside the fact that age is a risk factor, we are also educating people that peradventure you are aware that there is a history of glaucoma in the family, it becomes imperative that every member of the family at each point in time should ensure that they go out to have their eyes checked, examined, to check their eye pressure, check other factors, that may be associated with the development of glaucoma. So alongside with age and family history as risk factors, you can also have people with high myopia, people who are highly short-sighted. That is also another risk factor. So such that you can have younger persons with high myopia, which predisposes them to developing glaucoma if not checked. Likewise, other systemic conditions like hypertension, diabetes, when not properly managed, these can also bring complications of glaucoma. And then gene, race is also a factor. The black race, the Asians, Hispanics, we are more prone to glaucoma than the Caucasians. And if you prolong use of some drugs like steroids, can dispose one to also developing glaucoma. By and large, the basic thing is for people to be aware and do the needful when they can.
Okay, unfortunately, routine checkup is is very strange to us in this part of the world, and most people don't see a doctor until it is too late. What are the symptoms? Do we need to wait for symptoms before we know we are treating or managing glaucoma?
The truth is, waiting for a symptom to treat glaucoma might be too late for anybody because, like I rightly said, glaucoma sets in without sign or symptoms at the early stage. And remember, we say it causes irreversible damage. So assuming glaucoma is going to cause damage to one's eye and you're waiting for when the symptom will come, and the symptom comes at when the vision is damaged 80%. That means leaves the person with only 20%. So our advice or recommendation is that people should be aware that there is a disease called glaucoma that does not give sign or symptom. And that now behooves on us the responsibility to make it a point of duty to have our eyes checked, irrespective of whether we can see or not. Because the truth is, 50% of persons who come into the clinic and are diagnosed glaucoma, more often than not, come in with the fact that their vision is good, that they can see well at far and at near. They come in without the faintest awareness or knowledge that something could be wrong with their eyes. So if that is the case, then the truth is everybody needs to be aware and make it a point of duty to at least endeavor to have an eye exam carried out once in a year.
Okay, before we talk about preventive measures, let's look at the symptoms. Apart from blurred vision, redness of the eye, are there other symptoms one must look out for?
Well, the symptoms that could come with glaucoma varies depending on the degree and the stage, really. Blurred vision is one of them, but it doesn't come even at the stage of 50% loss, really. So, because what happens is when glaucoma is damaging the vision, it damages from the side. We call it the periphery. And we usually don't use our peripheral vision to view, so you won't get to know. Then in some few cases, some persons will experience seeing flashes of light, which is not common. It's not restricted to only glaucoma. There are other conditions too that can cause flashes of light. So it's possible that it may just come and go, and the person will not know. Some persons do see halos, as in they see colors around light bulbs, and some experience prickling pain. And the truth is, the prickling pain that comes, you may not even ascribe it to glaucoma because it just pricks and it goes away. So that is the reason why glaucoma is a bit difficult to detect by the individual. It's difficult for the individual to observe symptoms that will now spur or move him or her to go and check. And it is one of the reasons why we keep saying it, and we will continue to say it. Do not wait for any visible sign or symptom before you go and have your eyes examined, before you go and see your eye doctor. If you As a matter of fact, every child of 3 is of age to have his or her first eye exam. So I mean, if a child of 3 can have his or her eyes examined, then every adult 40 and above should make it a routine to have an eye examination at least once in a year.
The condition is irreversible. How do we manage and how do we live with this, with glaucoma?
Yes, the condition is irreversible, but it can be prevented. Damage to vision as per blindness from glaucoma can be prevented first by early detection. And early detection can only be done through an eye examination. However, when glaucoma sets in, the expectation is that your doctor carries out there are a series of eye examinations that is done before the doctor can tell you glaucoma has set in, before the person can be diagnosed with glaucoma. And then the necessary treatment procedure, management procedures are carried out. It can be managed with eye drops. It can be managed with surgery by the ophthalmologist. It can also be, and the surgical procedures now differ. There are some that can be done via laser, and there's a whole lot of management procedures that have been put up to take care of glaucoma. But by and large, the outcome of the result of management is a function of the time the glaucoma was detected. If glaucoma is detected late, not much can be done about the vision that is lost. But if glaucoma is detected early enough where there isn't any significant or much visual loss, yes, the vision can be very well preserved with eye drops, with medication, routine checks as well, because taking your eye drops or having a surgery done is not really enough. It's not the end of it. After the eye medications are recommended, after surgery is done, the person is also expected to return for routine checks, for re-evaluation, and to be able to manage and ensure that the vision is well sustained.
According to Glaucoma Research Foundation, about 10% of persons that have been treated of glaucoma still experience loss of vision and all that. How do you go about this, and is treatment actually accessible in Nigeria as well as affordable?
Of course, treatment is still very, very accessible. Now, you see, the glaucoma research findings, actually give the true picture of, what happens with persons who have glaucoma. However, this actually is not necessarily because glaucoma has set in, but sometimes because people do not pay full attention, they don't comply, they don't have full compliance with recommendations from their doctors. For example, there are different eye drops that are being recommended for management of glaucoma, and these eye drops are expected to be taken consistently. But more often than not, you find it that, out of human weakness and sometimes excuses, people fail to comply. And sometimes you see some people who just feel, after all, I can still see, and then they stay away from their medications. Then some use their medication and don't come back for routine check. Meanwhile, something may be going on. So these are the things that triggers off complication that now makes it look like, okay, after the surgery has been done, after the eye drops have been dispensed, yes, the person eventually experiences a visual loss. Although we still have pockets of cases where, because people didn't show up on time, and they showed up at a time when the visual loss is already severe. Now, when they come to the hospitals, when they go to the eye doctors, they are expecting to see some changes, some relief, some results. As per after the surgery, vision could be restored. And when it doesn't come, they kind of disappointed. But that is not the doctor's fault anymore, because like I said earlier, the damage caused is irreversible, irrespective of the treatment procedure or the management procedure being accorded. So the bottom line is that with early detection of glaucoma, there is hope that it can be very well managed and vision can be sustained and the person can have a very productive life, so long as the person is willing to comply and follow the instructions. Comply in terms of use your eye drops as recommended. If you're booked for surgery, go for the surgical procedure, return for routine checks, and I think that will suffice to keep vision intact.
The World Health Organization targeted year 2020 for the elimination of avoidable blindness. We are in year 2023. How have we fared, and what do you think the government and individual can do to change the narrative?
Thank you for that question. That's a fantastic one, really. Yes, because the 2020 has come and gone, and we are here, and there are other projections now. However, the good thing is that the awareness, the sensitization is on the increase. I'm talking of within our local space. The government is creating a lot of awareness. Like I know in Lagos, for instance, we have the blindness prevention units. And then the associations, the Ophthalmological Society of Nigeria, the Nigerian Optometric Associations, eye care practitioners basically are doing a lot of work. They are conscientiously putting hands on deck to ensure that the public is enlightened, to educate the people, to create and raise awareness, because that is where it starts from. When people become aware of what the problem is and what they can do, we are hopeful that they will take up the responsibility to at least help on their part, and that will help to prevent avoidable blindness. The truth is, we still have a lot of work to do. There is no doubt about that. But with agencies like yours, thanks to your sound bites on health, we are able to share knowledge, we are able to send information to the public, which when they hear, it will motivate them to spur them on to do the needful, and gradually we will get there. And even within our associations, we ensure that our members do the needful by educating their patients as much as possible. So it's actually, we still have a lot of work to do. There is no doubt about that in terms of awareness and education. And we are hopeful that with more government support, with more collaborations and partnership, we'll be able to take the information to all and sundry.
Your final words, anything you would like to add to your insights?
Well, glaucoma, it's actually a disease that causes irreversible blindness. However, the blindness from glaucoma can be prevented if detected early enough, if you go to the right practitioner. That is why we encourage everybody to take the responsibility of eye care. Take it very serious, because your eyes, your vision is priceless, and it cannot be replaced, really. We know that there are a lot of things contending for attention, but we are encouraging the public to make eye care a priority, such that every other thing because we know that every other thing we do borders on our ability to be able to see. And eyesight and good vision are essential for productive life. So we encourage everybody, if possible, make your eye examination your birthday gift to yourself, to show how much you value it, so that every year, no matter what, you will be able to know the status of your eye, and you'll be able to preserve your vision and protect your eyesight as well. Thank you.
Your vision is priceless. Beats invisible glaucoma. Your sight is your key to the world. Dr. Gloria Okoekhian, Chairperson, Nigeria Optometric Association, Lagos State Chapter. Thank you so much for your insights on living with glaucoma.
Thank you once again for having me.
All right. Sound Health continues with trending health report from around the world. Please stay tuned. program is still Sound Health on Lagos Television. More to come in a moment. This is where we say thank you on today's episode of Sound Health. Value your sight, save your sight. The world is actually bright. For comments and inquiries, or you have topics you would like us to treat, send SMS to 0035826603 or follow us on social media, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.